So while we have our part to deliver on the national plan, guiding us over the next little while so as to get open safely, and until such time as all Victorians who are eligible get vaccinated, we need to make sure that we take a very strong and very fast public health actions in accordance with the national plan when the epidemiological talk says we have to, when the evidence says we have to get on top of outbreaks. And that's why it's so important that when the Commonwealth announced there would be more GPs and pharmacies coming online over recent weeks, starting next week, that is so important to get more vaccines into our primary care providers, to get more points of availability, to get more vaccines into the arms of Victorians. So I take the opportunity to really encourage everyone to get vaccinated as soon as you can. And you can do this increasingly by checking for appointments, as I say, particularly with GPs and pharmacies, as more supply gets to them. You can also come to our more than 55 plus all the pop-up state-run clinics to make sure that you can get in and out quickly and safely, whether it be for AstraZeneca or Pfizer, subject to the Commonwealth making it clear what we're getting next month. And that's to avoid the kind of opportunities and the kind of devastation that we can see when the virus gets into families and communities. And we want to avoid that. That's why the national plan also is predicated on where you have to have localised, short, sharp lockdowns to avoid that devastation. Which is why the Chief Health Officer has advised us that we need to take such strong, fast, short, sharp action in the following 3 local government areas. The City of Greater Geelong, the Surf Coast Shire and Mitchell Shire will all enter into a 7-day lockdown from 11:59 p.m. tonight. The rules in these 3 LGAs will be the same as they are in Melbourne and Ballarat at the moment, minus the curfew. There will be 6 reasons to leave home in these areas. Necessary goods and services, shopping, everything you need, 1 person from that household once a day. Care and compassionate caregiving reasons, including medical care and getting a vaccination or a COVID test. And 3rd will be authorised work and permitted education. The 4th will be exercise. The 5th is outdoor social interaction. And as I say, the 6th is getting a COVID-19 vaccine. As a result of the changes in Metro Melbourne, once we hit the 70% single dose, the 4 hours a day for exercise and other social interaction applies as well as do the other recent changes where you can have 4 others join you if they are fully vaccinated. Otherwise, it's just the 1 person from another household if you're not vaccinated. The authorised worker system will be back in place for these LGAs. You'll need a permit. If you can work from home, you must work from home. And the onus is on your employer to ensure that that happens. But the most important message in all of that, so as to make it short and sharp and make sure that it's no more than 7 days and with a bit of luck, less than 7 days, is to get tested and to get vaccinated. Regional Victorians know what the show is here. They've overcome emerging outbreaks before. We've seen it in Shepparton several times. We've seen it in Mildura. We've seen it in Colac. I hope we're seeing it right now in Ballarat, which is doing an extraordinary job. And I'm sure we will see it in Geelong, in the Surf Coast and Mitchell Shire local government areas. And the public health teams, together with the local public health units and local governments and local civic groups, are right now engaging with local communities, local health services, to establish more testing and more support to make sure that we use this as an opportunity to drive ahead of the virus spread in those local government areas and get those communities back to being as open as they possibly can be and as safe as they possibly can be. Just very briefly on the wider outbreak in Metro Melbourne. The same patterns that we've seen over the course of the last period continue. The predominance of the virus continues to be in the north and western suburbs of Melbourne. We've seen 158 cases in Hume, 67 in Whittlesea, 40 in Moreland and 47 in Wyndham. There is again a continued growth in the southeastern suburbs, with now 16 cases in Casey, 14 in Greater Dandenong and 9 in Cardinia. Just back to the regions, and we've just seen one case in Ballarat, and that was a workplace contact of a known case. We've also seen one case in Bass Coast, a household contact of a worker related to a construction site. In the Surf Coast and Greater Geelong, we've seen 4. We've seen 2 in Geelong, a worker from Melbourne and a household contact of a separate construction worker. And in the Surf Coast, in addition to all the other cases that have been bubbling along there, we've seen new cases linked to trades and construction. We are still seeing repeat wastewater detections in Aireys Inlet with no obvious source of that case. In the Mitchell Shire, in addition to the cases that have been showing up over the last few days, yesterday we saw 7 cases. 4 are linked to trades and construction work, and 3 are household contacts of those different 4 cases. I just finish on one particularly sensitive outbreak. We've done extraordinarily well in aged care since the mandate for testing and vaccinations has come in, and now, of course, after Friday, it is compulsory that all workers either be vaccinated or have a confirmed vaccine time before the 1st of October. And we've seen a few outbreaks in staff, but it's being contained away from residents. At the Meadow Heights Aged Care Facility, we have 1 staff member and 2 residents test positive yesterday. One of those residents is in hospital and another one of those residents is transferring to hospital today. The good news is that 94 of those staff were fully vaccinated, 2 doses, and 77% of the residents were fully vaccinated. There also continue to be a number of spot fires in construction sites around Melbourne and regional Victoria relating to COVID outbreaks. We continue to monitor those, but can I urge everyone to keep an eye on the exposure site lists that constantly get updated, and as the Premier has, the most important thing you do is to get vaccinated, to support yourself, to support your family, your community, our hard-working public health and hospital workers, and make sure that we get down to that pathway of delivering the national plan and getting open and staying open.